I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to talk about how to stop shoulder pain. So we're going to go over a little bit of the anatomy of the shoulder because it's really important to understand that in order to understand how to stop the pain. So you have your bone here, which is your humerus, okay? And then you have basically this whole complex, which is your shoulder blade, a little bit of your acromion, the bone that comes here. All of this makes up your shoulder. And usually what happens is there's some type of irritation in the muscles of the shoulder when you have shoulder pain. Not all the time, but the majority of the time, most of your shoulder pain can be linked to a rotator cuff tear, a slap tear, an impingement syndrome, a tendonitis, which is all about muscle. So just for a little bit of reference, this is your pec. Up here, we have your biceps up here. Your triceps are in the back of your arm, and then you have your rotator cuff. And your rotator cuff is a bunch of muscles that sit in the back of your shoulder. All right, so a lot of times people will have some pain in here, and that could be coming from the rotator cuff. Some people have the pain in the front. That could be coming from the bicep, or it could be coming from a little bit of the rotator cuff. But either way, it's really important to understand a little bit about the anatomy of the shoulder before we kind of go into why it hurts, because the ways to correct why it hurts really causes or needs you to understand how the shoulder looks anatomically. So you have this bone here, and then you have your shoulder blade, and you have all your muscles back in here. So what happens is as you move your shoulder up and down, this bone moves, okay? But what happens is it'll start to, there's a space in between the bone on the top of your shoulder and this bone here. It's a really tiny space. But what happens is it starts to get closed off. Now, why does it get closed off? Well, that's due to a number of things. Could be to posture, could be to inflammation. So as this, what we call this little space right here, begins to close, that's when you start to get irritation. And a lot of times what happens is as this spot gets closed off, you start to use your shoulder a little bit differently. All right, so what you'll do is instead of being able just to move your shoulder up and down, is you'll start to shrug your shoulder, okay? Just giving it a little bit of protection before you move it up and down. And that's because you don't want that muscle to be pinched. So this muscle that runs through here, comes through the back, but it'll go through this space here, and it starts to be pinched, is a cause of a lot of shoulder pain. And another cause of a lot of shoulder pain is weakness. Okay, so weakness of the rotator cuff. So now that we know, here's the rotator cuff, here's the bicep, deltoids are out here too. Let's talk a little bit about how to stop the shoulder pain. So with shoulder pain, you have a bunch of things that can be affected and a bunch of things that can go wrong, so to speak. So your shoulder, if this muscle through here is inflamed, what can happen is as you go to lift your arm up, you'll get a pinching sensation. So we call this impingement. Usually you'll feel it when you reach overhead, you'll feel it when you reach out to the side, you can feel it in different positions, but most commonly it is when you reach overhead, it is when you reach out to the side. That muscle gets pinched. Why does that muscle get pinched? What starts that process? Most of the time that process starts with this type of posture, okay? Most of us find ourselves in this posture all day long, whether we're looking at our phone, whether we're in a laptop, this rounded forward. So as you round your shoulders forward, you automatically start to close that spot or close this opening. As this opening closes, there's no real room for that muscle to go through. So it starts to get irritated. You're just kind of jabbing at it all day long as you sit like this. So what happens is as you kind of poke at this muscle, and you're not feeling this, you know, you can sit like this for hours and you have no idea, but as you're just literally irritating this muscle and just poking at it, it starts to get inflamed. As it gets inflamed, it gets bigger. The hole is only so big, or the tunnel, I should say, is only so big that it has to go through. So as this gets bigger and bigger, because of inflammation, it starts to become more painful to lift overhead. Most shoulder pain is non-traumatic, meaning nobody knows why it happened. It's not something that you fell and you're like, oh yeah, I remember hurting my shoulder. Most people come in and are like, I have no idea how I hurt my shoulder. It just really starts to hurt. I have a problem lifting overhead. So one of the first things you can do is work on your posture. Sitting in this position will cause inflammation, which will then cause rotator cuff tears, and so on and so forth. So this, okay, can be corrected by just rolling your shoulders up, back, and drop them down. Now you don't want to glue your shoulders all the way back because that is overcorrection. So then you're going to wind up irritating or being much more uncomfortable in your back or your thoracic spine back in here, okay? It's just a simple up, back, and drop them down. Nothing fancy, okay? But what happens is you want to make sure you're doing this 1,000 times a day because until you retrain your muscles, this is where they need to be, you're going to be like this, okay? So when you're holding your phone, you're sitting at your computer, things like that, you really want to avoid this posture. So sit up, roll your shoulders back. This is going to help open up that shoulder joint. The second thing that you really want to pay attention to and how you can stop shoulder pain is watch how you sleep. Now, we've done a video series on how you should sleep with shoulder pain. You can refer to that to figure out how you should sleep, but you really don't want to lay on that affected shoulder, and you don't want to lay on your stomach either. You want to make sure that this shoulder has enough room to, so quote unquote, breathe, and that tendon that goes through there has enough room to breathe. So sleeping on the unaffected shoulder, hugging a pillow, is the best and most comfortable way to stop that shoulder pain. Again, if you want to refer to our other video that talks about how to sleep when you have shoulder pain, feel free to do that. And the final thing is exercise like a deltoid lift that's going to strengthen that cuff. You actually have to do specific rotator cuff exercises. And if you're not doing them, your rotator cuff's not going to get strong. It's like balance. If you don't practice it, it's not there. If you don't strengthen the rotator cuff, it's not going to be strong. You still may be able to do everything. You still may be able to perform all your activities. But as your shoulder gets weaker, you're going to find that it's going to hurt a lot more because it's actually weak. So what you want to do is you want to do some strengthening exercises. So you can do a couple of exercises. Rotation is one. So if you have a band, you can hold the band here, rotate out. You can lay on your side with a weight in your hand and rotate up, okay? You can just do some simple scap squeezes. Now when you're doing your scap squeezes, you want to make sure that you're squeezing down and back and not up and back, okay? Because this is going to strengthen your upper traps, which you're not really looking to do when you're doing a shoulder squeeze. So something just as simple as that, okay? And that's also going to help you with your postural correction and allow you to sit up without getting so fatigued, and that will help reduce some of that shoulder pain that does occur. So the three things that you can do to stop shoulder pain is posture, okay? Roll your shoulders up, back, and drop them down. 2, correct your sleeping position. Again, refer to our video on how to sleep with shoulder pain if you have questions on that, but on your side, hugging a pillow, this is the best way. And 3, strengthening that rotator cuff, which is the muscles in the back of the shoulder. There's a couple of other exercises we didn't get to, but those are some of the basics, but being able to do those 3 things will help you eliminate your shoulder pain. If you are experiencing shoulder pain and want a consultation for free with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.